The FIBULINK system is designed to stabilize a disruption of the ankle syndesmosis while allowing the anatomic motion required during a normal gait. It may be used to treat an isolated syndesmosis disruption or in conjunction with a fracture repair. After the syndesmosis is reduced or clamped per the surgeon's preference, installation begins by inserting a K-wire through the fibula and into the tibia, approximately 2 centimeters above the plafond. Once proper placement is verified, the provided step drill is driven over the K-wire to drill a 3 mm pilot hole in the tibia and a 4 mm gliding hole through the fibula. Ensure the larger portion of the step drill does not plunge into the tibia. The preloaded self-tapping tibia screw is then inserted through the drilled hole and is threaded into the tibia. An increase in torque indicates that the shoulder of the driver has contacted the lateral tibia cortex, indicating that the screw has been fully inserted. Note the indicator on the driver. If it remains visible above the fibula or plate, then the standard fibula tensioning cap should be used. If it is below the surface of the fibula or plate, then utilize the long tensioning cap. Release the green retention suture by unwinding it from the back of the driver handle. As you remove the driver, the green suture will also be removed, and the guide tubes will become accessible. The appropriate tensioning cap and knob are then placed over the guide tubes, and a clamp is attached to the silver portion to prevent its rotation. The guide tube is pulled laterally to bring the external threads of the fibula link into contact with the internal threads of the tensioning cap. Clockwise rotation of the tensioning knob threads the cap onto the link and applies pressure to narrow the syndesmotic gap. The mechanical advantage provided by the link cap interface means that the surgeon will not feel a bite the same way they will with an orthopedic screw. Note that an over-torque indicator is built into the knob to prevent construct failure. Further tightening or relaxation of the implant can be performed as needed by rotating the tensioning knob clockwise or counterclockwise. Once the surgeon has evaluated the ankle and determined that the procedure is complete, the gold tube can be removed, followed by the silver tube and tensioning knob. To remove the FIBULINK implant, a dedicated instrument kit is available. Use the tensioning cap remover to remove the cap. If the link remains in the fibula, utilize the link and screw remover, which is the same as the driver in the implant kit, to push the link into the base of the tibia screw. Once the hexalobe-shaped link is engaged inside the female hexalobe portion of the tibia screw, both can be reversed out of the tibia and fibula. In some instances, the link may be removed along with the tensioning cap. Once removed, insert the tibia screw remover, a hexalobe retrieval driver, into the tibia screw and reverse thread it out of the tibia through the initial implant site.